want to welcome everybody to our podcast today. We have a resident expert on lasers, what they can do for your practice, and why you should have one today. My name is Dr. Vincent Dolce. I'm here with Jack Mano. Jack is our resident business development person. He's a consultant for Quantum Health Holding, and he distributes the laser here in the United States called Light Touch. Jack, welcome.
Thank you, Dr. Dulce, for having me today.
That was a mouthful. So Jack, I grew up with the water lasers, and what I want to do today is contrast what's happened with the lasers in the past few years, because it's been a while since I played with the laser. But I want to know, should dentists really seriously consider having a laser in their practice?
Great question, Vinny. I ask that question to doctors all the time. When they inquire about a laser, their first question is about cost. That shouldn't be their first question. It should be more about what it can do for them in their practice as far as an ROI based on what procedures they want to do with the laser. So by all means, every practice should have a dental laser, in my opinion, because virtually they weren't trained in school with a laser. They were trained with a blade, right? With a blade and a drill. So they're not experienced enough to have the experience of having a dental laser to know the differences. In my few years of doing this and working with doctors that have acquired a laser in their practice, being the Light Touch, I can tell you now that every single doctor testimonial says that they should have bought this before they bought any digital workflow type CAD/CAM program or machine for their office. They should have bought this first.
Yeah, to me, I equate the laser to the handpiece. I mean, you can't do dentistry without a handpiece. And today, with today's dentistry and what's all involved in implants and veneers and gum problems, you have to have a laser to treat all these procedures.
Yeah, listen, to put clarity on that, in addition to what you just said, Dr. Dulce, the laser is just another tool. That's all it is. It replaces the drill and it replaces the blade. It's a handpiece that has versatility. So they're used to handling a handpiece. So there's no difference. It's just a matter of being taught how to apply the laser and understanding the science of a laser. The lasers of today, you mentioned earlier that you grew up with a water laser in your practice. And that's got to be many years ago, because I know you're
25 years ago, yeah. Yeah, I love it.
So, the lasers, the technology today, not all lasers, but this particular laser, the Light Touch, protects you from violating tissue you don't want to be violated.
Okay.
Because of the programming that's in the unit, and that's to do of the advanced technology that it's incorporated in the laser. And that's what needs to be taught when you're teaching doctors how to do things, because that's the number one question that doctors have when they're, say, ablating a cavity.
Right.
How do I know I'm not violating the pulp?
Right.
Well, if you understand the science of lasers and the water absorption percentages that every tissue has, high or low water absorption levels, you will understand how this Light Touch laser is applied and how it protects you. Because basically, and it's all because of wavelength and energy and the programming of the unit.
So it helps you not interfere with the pulp.
It doesn't violate. If you just want to remove enamel, you'll just remove enamel and not soft tissue. Okay. In that regards.
Okay. Cool. So it does cavities. Jack, they talked about numbing up the patient when I had my laser, and honestly, in my hands with the water laser, it really didn't work. Is that
Right.
something that your laser does, the light touch?
Well, that's a great question, Vinny, and the answer is yes.
Okay.
Um, the you do not need to anesthetize patients
Okay.
for majority, and I'm going to say majority, like 98% of the disciplines in dentistry today, as
Okay.
far as procedures,
Gotcha.
except when you're doing major surgeries naturally.
Right. Right.
I'm talking about major surgeries, maxillofacial type stuff and things like that. But and even if you're doing periimplantitis cases, depending on the severity of the severe of the actual periimplantitis case,
Right. Right.
you might want to anesthetize. And according to the patient, every patient has a different tolerance of numbness and pain. So, from what my opinions and what I saw in the last few years doing this on
Okay.
live patients, everyone wasn't anesthetized. It wasn't needed, and that was
And
for
go
okay.
ahead. Sorry.
That was just as far as removing crowns, veneers, all ceramic zirconia units. So that's Dr. Dulce.
Vinny.
Laser technology is not a new technology. It's been
Right.
around for years, over 30 years. As you just mentioned, you practiced with a waterways 25 years ago. You're aging yourself, but you look good. um, what's changed is the technology to apply that laser science.
Okay.
That's what's changed.
So it
And that's
allows
what
you to
doctors
prepare.
don't and that's what doctors don't know.
Right, right. One of the things that impressed the heck out of me, we met when I was doing veneers, and apparently this machine can remove the veneers without damaging the structure of the tooth underneath.
That's correct. And let me explain what it does. Basically, it
Okay.
evaporates the cement. It
Ah,
just evaporates the cement.
cool.
Like I said earlier, everything has a water content, including cement. So when you put it in the mode of removing veneers or crowns or zirconia, you're putting it into a mode in a hard tissue category program
Okay.
that basically will just evaporate the cement because of the water content and not destroy the understructure of the underlying preps.
Wow, that is such a big, with all the veneers out there. I mean, my veneers that I placed are got to be 25, 30 years old. I mean, so it's almost time for a
Yeah,
change.
yeah.
And to be able, so anything ceramic, like a crown or a veneer,
All ceramic. Correct.
okay, the light touch can remove it without
Not a PF,
really.
not a PFM.
Right. Yeah, no metal.
It and that's a good point to make at this time, because the laser light does not penetrate metal. It does
Right.
not damage the metal. It doesn't penetrate the metal, which is a good thing, especially when you're doing periimplantitis cases.
Right. Yeah, let's talk about that. I mean, implants are all over. I have some implants that were treated with a laser because they're failing. So you can slow down the process or even stop the progression. Okay.
Yeah, absolutely. I actually did a case for a doctor using the light touch laser for the first time.
Okay.
She brought in a periimplantitis case. She did a labial flap.
Okay.
She then proceeded to trough around the implant to the point of exposing all the bacteria that was on the implant.
Right.
She removed all the plaque, cleaned it up 100%. She regrafted some bone and stitched up.
Yeah,
And
she saved the patient from going through a new implant or taking the implant out, putting bone in, and all that nonsense that takes
it
months and
wasn't
months.
it wasn't a severe implantitis case,
Good.
periimplantitis case, but she did that with no anesthesia, Vinny.
Crazy.
No anesthesia. And
Crazy.
she did it in 20 minutes, if that.
Yeah, that's the difference. The patients look. I think when a patient walks into a modern dental office, they expect us to have the best equipment, the most modern equipment. And as we know, I will talk about it other times, that's not always the case. But I don't know how I couldn't have lived without my laser. I used it every single day. It's
Dulcie,
something.
you just made a great point that patients should expect doctors to have today's
Yeah,
technology in order to treat. Unfortunately, you can't dictate that in mandates. It's a prerogative what they buy and what they not buy. However, go get eye surgery.
right,
What do they use?
right.
Would you prefer a blade on your eye, or would you prefer a laser on your eye
Right, exactly.
with
Yeah,
a topical anesthesia? Okay. Versus you couldn't use a topical if you were using a blade on an
right,
eye,
right.
have to be knocked out.
Not only
So
that, you can't control the accuracy, you can't control the
the
precision.
precision,
The
exactly right,
precision of the laser is unequal.
is
It's
eggs.
better than a handpiece. It's better than anything, a blade for sure. But we still have docs. It's funny. They did a survey and they found that docs want a Tesla because it's the most technologically advanced car, and yet they don't have stuff like a laser or other technologies that we have. It just boggles
It's the
my
same.
mind. I don't get it.
It's almost the same, and it's almost the same analytic. Like, why do patients go out and buy $100,000 car when they have no teeth?
Right. Yeah, I know.
I mean, why don't you spend your money on your teeth? Because we do know no teeth is a problem as far as heart conditions, diabetes, so forth, as far as masticating properly and being able to digest properly. It's the same type of
The same mentality.
mind-blowing.
Yeah. I
Yeah,
mean, I
yeah,
mean,
mentality.
the doc today, I think once they get used to it, and they have to, I saw the design of this handpiece on the laser. It's totally different than what I had. I had this big cable, and the cable broke a couple of times. The cable was like $3,000. I
Right.
mean, it was insane. The
And
money
I'll
I
and
spent.
I'll and I'll explain that. And that's one of the advances in the technology today.
Okay.
Fiber optic delivery on these other units, you mentioned waterlays. There's mirrors inside that tubing,
Okay.
that bar,
That's why it's so
which
expensive.
and that's exactly why it's so expensive. And with the light touch unit, which is really neat about the technology, the laser energy crystal is in the handpiece,
Wow.
not in the body of the unit.
Wow.
Where with the waterlays, the light energy comes from the body of the unit, gets delivered through the fiber optic delivery,
Yeah.
which kind of prohibits you from moving it from room to room. Because if you bang that tube against the wall and you misalign those mirrors, you have a calibration problem now as far as light energy.
I used to
So that's
carry that machine from room to room because I didn't want
yeah,
it to trip over the threshold. I mean,
right.
I was so careful with that machine.
Yeah. So that's the advances of the light touch laser that the other units they don't have. It's not fiber optic delivery. That's old
Okay.
technology.
Okay.
So and just one added point to that, since we're on the laser and the handpiece, if ever your laser, you drop the handpiece and it needed repair, just give you an
Sure.
argument. You
Sure.
unscrew the handpiece, you send it back to the company, they give you a loaner, so you're never down. Where
Wow.
the other units, you have to transport the whole unit back to the manufacturer,
Trust me.
ship back a $75,000 waterlays.
Yeah.
How much
Yeah.
it cost you?
Yeah. 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 Yeah.
and you did,
I was
and you
lucky. I had a guy who fixed mine, but
there you go.
at the end of the day, it died inside. It was done.
And I'm not here to put down waterlays. I
No, no,
mean,
no.
listen,
It's a good
it,
product.
it it's a good product, but it's not to today's standards as far as I'm concerned, as far as technology.
Okay.
You
Yeah.
mentioned something earlier
Go
about
ahead.
you with that you had to anesthetize
Oh yeah.
patients.
Oh yeah.
That's because of the wavelength.
Okay.
That laser is an erbium chrome laser,
Okay.
which is which has I believe it is 2780 nanometer wavelength, whereas the light touch is 2940.
Got it.
200% higher as far as the water absorption rate. It has a 200% higher water absorption rate. That's where the precision comes in.
Okay.
That's where it protects you from violating tissue you don't want to. Give you an example, and this is a cool thing that I do with all my doctors when they do my demonstrations, Vinny. I take
Okay.
a brown egg.
Okay.
and I put it on the program for hard tissue, and I
Okay.
remove the shell without penetrating the membrane underneath
Wow.
the shell.
Wow. That's crazy.
Well, these other lasers can't do that.
Right. Right. It
They
would
go
crack
deep.
it.
They'll go deeper.
Yeah.
And that's where you have to anesthetize sometimes. And that's the difference. One of the
Yeah.
differences.
Yeah. I mean, when I got my laser, they said you could do this and not everything was true. Not in my hands anyway. I'm glad they, but Jack, I think we need to talk about too, when I got my laser, at that time, it was a ton of money and there was no training. They literally shipped me the laser. they, they shipped me the laser and said, good luck. And, I kind of had to figure stuff out.
Read the manual.
I'm telling you, they didn't help me. They did
Yeah.
not help me with the instructions, or they didn't have somebody come and really show me. Do we have a training program for the doctors?
Yeah, so let me explain. That's a great point, Dr. Dulce. When you acquire a light touch laser, the price of the unit basically includes shipping and clinical training in your office on live patients.
Wow.
Okay.
Wow.
So with some of these other units that are on the market, some of them have trial periods and this, that, and the other thing. You're working on a pig's jaw. You're not in the real mouth.
Yeah.
Oh, you're not in the real mouth. You're not in the mouth. It's the real one. You're not in the mouth.
You're not in a human's mouth.
Right. And that's the difference. It really is the difference in training.
Yeah.
Because when we take this laser, we take the patient's hand and we take the laser handpiece and we apply the laser to the hand. And we say, this is what you're going to feel. We'll say, I don't feel anything. Well, that's my point. You're not going to feel anything.
Cool. Yeah.
So that's a big difference.
Yeah, you have to differentiate yourself, my opinion. I mean, and somebody who has a modern practice, even a solo guy, he's going to be involved with implants. He's going to be involved with veneers. He's going to be involved with gum sculpting and post ortho. I mean, how do you do all that without a laser? You can't.
Right. Right.
You can't.
I mean,
you can't do it.
I'll give you an example. When we do our trainings, we ask the doctor, number one, what do you want to mainly focus on? Some guys say they want to get rid of cavities.
Okay.
Some people say they want to remove veneers. And they don't understand the time savings when they do that. So now they have all this extra time. Now we grab some of the assistants and some of the staff. We say, okay, do you have a canker sore? Do you have any sensitivity on your tooth? Do you have, you want to change your gummy smile and do a little gingivectomy? And they looked at a gingivectomy. We've done gingivectomies on not major stuff, minor stuff where we change the tissue, where we change the tissue architecture in minutes, where these people were eating lunch a half hour later. There was no pain. There was no discomfort with no anesthesia.
And the gum doesn't shrink like with surgery. The gum stays
right.
Wherever you cut the gum, it stays there. It doesn't move. Which
right.
So
I'm going to bring something to your attention, and I might go off track a little bit, but you can edit this, whatever you want to do, Benny. Laboratories and doctors work hand in hand. So what happens? Patient comes in, they want to change their smile, they want to change their gummy smile, they want to do this, they want to do that to make a nice smile makeover, which all is in conjunction.
Is what
we did. You and I did that for years together as a doctor lab. I remember those days. Great communication with wax ups and so forth, right?
Yeah.
So now the doctor does a gingivectomy, takes away without violating biological width. Okay, right. Does a nice, and sometimes they do that. Some of them do it with a diode, which chars the tissue, and it leaves. It could result in some after effects as far as infection and so forth.
Right.
But they never book the patient at the time when they leave, when they do that procedure, because they don't know when and how the tissue is going to look, how the patient's going to feel. So they wait for the patient to call them back and say, hey, I feel great. I think we should do this. Or the office calls the patient, says, how do you feel? Well, I still feel a little soreness. Okay, we'll wait another week or two. Okay. That doesn't happen with lasers. Lasers,
I did everything the same day. I sculpted the gum
lasers
tissue.
Biosimulate. Yeah. They disinfect, and the healing time. So the point I'm trying to make is A lot of times the doctors lose the case because the gingivectomy was done so well. The patient says, "Oh, wow, I look so much better. You know what? I won't go through the veneer process. I'll
I'm
just
not
deal
going to
with that."
spend 10 grand. Yeah.
Right. And the patients don't come back.
Yeah.
And that doesn't happen with a laser. As you just said, you did everything sometimes the same day.
Yep. Yeah.
Within 4 or 5 days, you have that patient scheduled. The day they leave, you have them scheduled to come back without asking them how you feel.
Right.
Because you know that tissue healed quickly and accurately.
Yeah, I mean, I couldn't live without my, and today there's so many procedures. Can you use the laser for root canals, Jack?
Absolutely.
Okay.
You know, I have a pro and con about that. I
Okay.
mean, all these endodontists, they have all these expensive tools and instruments that they use to remove a root. A lot of times I'll say, do what you're doing,
Right.
but then use the laser to go back in to disinfect and get rid of all the smear layers and
Yeah.
get rid
Before
of
you seal it
anything that's
up. Yeah.
inside
Before
it
you seal
before
it
you
up.
seal it up.
Absolutely.
So that's one approach.
Yeah.
The other approach is that you could do the whole procedure with a laser without removing a lot of the enamel on the occlusal surface to reach the root.
Right.
So there's a whatever you're comfortable with, but a laser should always be used in
Right.
some respect.
Right. No, like I said, it just, and it's going to make your practice stand out, which really is the main point. I mean, why should people go to you? They're going to go home. That patient's going to go home and say, "Wow, the doc had this fancy thing, and I didn't feel anything." And that's what you need. How much is that worth? I mean,
Well, that was a statement that you just made that's worth $1 million because what patient is not going to tell a friend? I just came back from Dr. Dulce's office. He got rid of a cavity. He did some tissue recontouring. I had no needles, no pain. I was like, wow, what that word of mouth referral, how much is that worth to you as a dentist?
Yeah, exactly.
So
Exactly.
give me an example, Vinny. You know me, I'm Italian. I talk, but sometimes I talk a little.
We both do, yeah.
I have my 6-year-old granddaughter
Mhm.
who had a bad experience with a pediatric doctor on removing a couple of cavities. She never wanted to go back. So when I saw her, I was telling her, listen, Grandpa's got this machine that the doctor's going to use on you. You're not going to feel anything. You're not even going to have any needles. And she said, Papa, really? I'll try it. This is what she said, I'll try it. So I recommended her to a doctor nearby that bought the laser from me. After the procedure, she went to the doctor, and the doctor says, well, we have a couple more that we have to do. She says, you're done already? I didn't feel anything. When do I have to come back? I can't wait.
That's cool.
You just got rid of the dental phobia of a 6-year-old.
Right.
What does that mean?
How much is that worth? Yeah, for children, the laser is phenomenal.
It's unbelievable. So,
yeah,
I believe in what I'm doing. I believe in what we're saying. It's just a matter of education, Dr. Dulce. And then there's the whole financial side of it.
Yeah, I mean, right. The ROI on a laser is, it'll make or break your practice, my opinion. Could you go over, where's the laser manufactured, Jack?
It's an Israeli manufactured unit made in Israel.
Okay.
The technology is made in Israel. So if you're familiar with the way Israelis do things as far as technology goes, they're on top of their game. Everything is an OEM. It's not third party stuff. A lot of the stuff as far as the unit itself is all module boards. Basically, the only thing that's really a major cost to any laser is the crystal that you never want to damage, because that's where that's the guts of the unit.
Right.
But everything else is motherboards. 90% of the repairs that we could do over the phone, because it's got a self-curing system, basically, and if it doesn't self-cure, then you have to send in, then we need to send it. We don't ask this is really cool. They do not ask to have you send the unit back to them. They will send a technician to you.
Wow.
To fix it in your practice.
Crazy.
Yeah.
That's
if it's
crazy. Well, you guys are like a Tesla. You can fix the thing without playing with it. That's great. And
yeah, it's
Jack,
really yeah.
the elephant in the room for all dentists is how much? I
Right.
mean, what? Just go over that real quick. I know.
Sure, I'll be glad to. Um, the unit sells for 55,000.
Okay.
It includes shipping and clinical training.
Okay.
Um, it comes with a bunch of array of different tips. Um, and I'll talk about that real quickly. A lot of questions. How long do the tips last? Well, the tips could last a long time. I have guys that haven't replaced any of their tips in a year.
Wow.
Depends on how you care for them. You can autoclave them. When you're working with your assistant, you're working with one handpiece, the laser. Every time you take it out of the mouth, the assistant has a little swab, cotton or gauze with alcohol. She dabs the tip. You go back in the mouth. So depending on how you care for it, and I'll give you another example. When you're working with hard tissue, you need to be at least 2 millimeters away from the hard tissue.
Okay. Wow.
When you're on soft tissue, you're on the tissue.
Right.
But the
Right.
key to a laser is fast movement. You want to always have fast movement. It's not like a blade where you do things slowly. With lasers, you do things fast. So when you're doing a precise cut with a laser, you're doing it in a nice, consistent motion. And that's really, I mean, so to get back to cost, yeah, it's $55,000.
Okay.
We break it down to about okay. We break it down to about $1,000 a month.
Okay. Okay.
So, how you doing, buddy? Good to see you. A buddy of mine just came back from New York.
Hello.
So thank you, buddy. So
And you said you could go 6 months without payments.
well, yeah, I mean, I have programs that are phenomenal right now. I work with a certain bank right now that offers
Okay.
no money down scenario, 6 months of zero payments,
Okay.
6 months of $99 payments,
Okay.
and up to 6 years worth of financing at 6.75%, which is
Wow.
under the prime rate.
Right. It's
So
reasonable.
it's a 2-hour approval. You don't have to
Okay.
hand them a bunch of financials, business financials.
Okay.
All they ask is they want your ID number as a doctor. They want your tax ID number and
Right.
how long you've been in business and how long you've been in business.
Yeah.
That's it. That's the
Cool.
that's the application. No financials.
To me, that's the
So
way. Yeah, that would be the way to go. Instead of laying out that money, it doesn't make sense.
well, number one, everybody has a different reason why they do financing versus why they pay something in full. The good news is that you'll get at the end of the year, you'll get your capital gain advantage on your
Right.
taxes for purchasing.
Yes,
I
sir.
believe on a $55,000 unit, your tax advantage is around $15,000 that
Yeah.
you can deduct,
Yeah.
which is huge when you think about it. So you take 55,000 and you take 15,000 off. What you're paying? What?
Yeah. You
40
got
grand.
40 grand, right? I know. Which you
The
can't
other
even buy
units
a
that are on the
car.
market, the other units that are on the market, Vinny, when you're talking about money, I believe, without mentioning names, the one that's close to us in price is somewhere around 70,000, 75,000.
Right.
The one above that is about 95,000. Then you have the CO2 lasers, which are different.
Yeah.
Those are medical lasers that are very good lasers. Don't be me wrong, but they're monsters. You better have a big operatory to have one in it. You can't move it from room to room, and they're over $120,000
Yeah.
or $110,000, which is
Yeah.
that's you could buy two R units for one of those, and it's an Erbium YAG laser, so that's the difference.
Okay.
I'm sorry, hold on a second, Vinny.
Say, why don't you come on?
You got it. Yeah, bud. Thank you. My Goomba from New York. So anyway,
So listen, we're gonna have more. We're gonna have more. I'm gonna put in little videos. I know you have a bunch of videos on procedures that the laser can do, and we'll include those in our shorts. And stay tuned. This is one of a series of lectures, basically, that is here to educate the dentist. My goal is to help the dentists max out their practice.
yeah, and what if I may add one closing point. I mentioned earlier, it's about education. You don't know what you don't know until you know it.
Absolutely.
And it's important to understand the differences in the different lasers that are out there.
Absolutely.
What a diode does, what an erbium chrome laser does, what an erbium YAG laser does. Some lasers have a combination of dual wavelengths where they have erbium YAGs and a neodymium type laser where they do LANAP procedures and so forth. You could do a LANAP with the light. You could do everything with a light touch. You really can. And then you have the CO2 lasers. You got to know the differences.
Yeah. You got to be educated, and the beauty of dealing with you is you can turn people on to a bunch of dentists that are using the laser.
Oh,
you know what I mean? They could go visit their practice if they want. You know, that's what I did years ago. If I had a question.
You know, one more point, Vinny. I'm sorry to make this any longer for you. We do not work through like a Shine or a Patterson. We deal with, yes, I mentioned earlier that Quantum Health Holdings is a distributor for light instruments, but it's owned by a dentist. It's owned by a laboratory oral design guy, Jack Manna.
Gotcha.
When that we have other people out there that are 1099 distributors where they're just salespeople.
Okay.
But we don't ask them to sell it. We just get the interest. And the doctor and I are the ones that do all the education as far as making them aware. And there is in-house training on live patients, not on a pig's jaw.
Oh, cool.
Big difference.
That is so cool.
Big difference.
Yeah, I mean, so, you know, if you want more information, Jack, I'll put your information in the video so that they can get a hold of you. But just give me your telephone number or your email.
Sure. I have a couple of emails, Vinny. The one on the Quantum is jack@quantumhh.com.
Okay.
And my other email is jack.l.mano, MANNO, @gmail.com.
Okay.
.com. And my phone number is 917-930-7174. I think you had that 25 years ago.
Thank you, Jack. It's always a pleasure. I enjoy talking with you, and thanks for the help with the laser.
I appreciate it, and Vinny, I look forward to these segments of your podcast because it's all about education.
That's what we're trying to do. We're trying to educate the dentists so that they're not alone out there. You know, because I didn't have much help. When I was coming along, I just saw the laser and bought it. I was like, okay.
Back in the day when you were on Long Island, you were a pioneer in everything you bought.
Yeah, exactly. Yeah.
You really were. You were one of the first guys that I knew that were doing veneers back in the day.
Yeah.
And the old analog.
Thanks to your lab. Yeah. I mean, I miss that. That's one thing I do miss.
Yeah, it was fun. Fun times together, brother. Always.
Yes, sir. Thank you so much, Jack. Jack, hi to the missus. Have a good weekend. Thank you.
Love you, brother.
Bye, sir.
Thank you, Dr. Dulce. Bye-bye.